the barriers. I can tell you right now that we've secured more PPE through donations than the county has supplied us.
See?
So that's a barrier. We're not getting the resources from the county. We went out on our own, got grants and money, and got our own. So we are getting around the barriers every day.
You talking? That's what I'm saying.
Well, we're doing it every day. You're making the assumption that we're not doing it. We're doing it every day.
You're assuming that I'm assuming.
Your words. Your words said that we need to do something that we're already doing.
I don't know if you know. Sorry, you may have seen me the other day. I was out there in the street, passing out those very masks that you said you got, 1-to-1, person to person. So I understand that you're working hard, and I'm not criticizing. See, you know what I'm.
I don't think I'm being criticized. Look, I'm not that sensitive, but
Okay.
I'm on to sharing information for the most part. I think like you said, a lot of people don't know, and just based off the questions that has been asked, it proves the point, like you said, that a lot of people don't know. So if you don't know, I'm sharing that information because part of the communication process is me sharing that information to you, you sharing it with your people, and other people sharing it with their people, and it gets out, and then we have a more informed community. So I'm more of a crisis communication person. I think we should let people know what's going on and what the processes is so that we can have a better and more informed community.
Yeah, and as an incident commander, you know people panic when they're hit with unfortunate information all at once.
True.
If you bring them along through the process, they're not likely to panic as badly.
That's true.
If things go south. But if all of a sudden you tell them, bam, that's when they panic. And then they don't know what to do because they haven't been informed what to do in response. So that's
we have been communicating with them what to do.
Somebody's asking a question. That's Ms. Johnette. Go ahead, Ms. Johnette.
Okay, so what I've heard so far is there is a COVID-19 plan for the city of Trenton. Correct. That plan, at this point, when it comes to testing, there are criteria that has to be met.
Correct.
And so therefore, if those criteria are not met, then some folks are not being tested, but that does not mean that that plan is not for all of Trenton.
That's correct. It's for everybody. Yes.
Right. So
everybody who's symptomatic.
Well, we haven't
because a lot of places haven't gotten to the asymptomatic testing yet. So we're going in stages.
That's right.
So,
correct.
The other thing that I'm hearing is that if there are people who don't have insurance, then Henry J. Austin is set up to meet those people and to help those people get tested. Is that
correct.
Not right, Dr. Evans?
That's correct.
Okay. So the other thing that I'm also hearing is that there's a somewhat of a lack of communication. And by ways of communicating, we have the internet.
Yes.
And we have flyers have gone out.
Yes.
And Algernon, you suggested texting, but I think that's probably more complicated than the internet and flyer.
But we're working on that too. So we actually we've actually communicated through robocalls.
Okay.
If you go to the city's website, you can actually sign up to receive text messages. So we are using all forms of communication.
Okay, and I agree with that because I think I did get a robocall because I'm on that.
That's
so
correct.
my other thing is that you talked about what happens in the housing authority and the nursing homes, and you're saying now, from what I understand, that they are funded by federal government and they have to follow federal and state government rules.
Correct.
Prior to the local or before the local or whatever. They can't just hop on the local, whatever the local is saying, if they're not, because the funding comes from federal or state.
That's correct.
They have to also follow that federal or state guidance as well.
That supersedes, right. That supersedes our guidance, yes.
Right. So in essence, I think that we just have to learn how to formulate that communication so that it's clear that Trenton isn't neglecting nursing homes. They're not neglecting housing authorities, etc. There's a process that has to be followed, and we have to educate ourselves to those processes.
That's
I worked along and I'm part of a board on Trenton Health Team, and I know the great work that they do and the diligence that they have towards the city of Trenton. I know Greg and I know Dr. Evans. So I think that I agree that there may need to be more communication, but I think that that's something that has to come up with the mayor and how the mayor puts out that information. And so therefore, I'm just surprised. Was he invited to the call? Was somebody from his office invited to the call?
First one I invited.
And so therefore, some of these questions and some of these concerns we have, and especially in terms of communication, et cetera, I feel need to be directed to our city administrator's office, even though Mr. Sawyer, Director Sawyer, is here representing his part of that. But we don't have the health director on this call. We don't have anybody from their office. We don't have anybody from the city administration. So some of these things need to come from another source,
So
in my opinion.
I think with the communication piece, I've been involved in the daily communication process with the mayor. So I think he has done a lot of communicating. Not saying that he can't communicate more, but if there's more, this is the time to give us that message so we can go back and say, Mayor, you're communicating, but we need more. So if you need more, tell me what platform you need more on, and we'll work to do that. So like I said, this is a whole community approach, and communication is two-way. You tell us what you need. You tell us what you need. It's my job to go back and make sure we get it done.
Well, and Jeanette,
I'm gonna stop for now.
No, you're good. I mean,
you right?
No.
Were you done?
Cool. I'm cool.
Well, I think that daily briefing is important. I want to go back to that, and if we can unwrap that.
Okay.
If you want to convey a message to the mayor, I would suggest a daily briefing by the mayor.
To who?
Anybody would
The general
listen?
public.
Okay, so what format would you like that in?
Again, I recommended WPVI Studio.
Okay.
You mentioned that you guys are using robocall. All those forms of communication are good,
Right.
but why not use the power of TV?
Exactly.
WPVI gives you 5 or 10 minutes. Why not take it?
Right.
All right. So I think in that situation, we probably have to see if there's a cost associated with it. There are some free services also, but I'll definitely go back and say, Mayor, can we get on TV more for the community? That's not
Facebook Live. Can people react to that? Because I know we've seen quite a bit of pickup around some Facebook Live events. Mr. Carl, would that be a good format, do you think?
Facebook Live is great, but my major concern with that, and again, it's associated with the schools as well. A lot of folks don't have access to the internet. They don't have laptops at home. So that's one resource, Mr. Paulson, and I agree we should utilize that. But a lot of folks, most folks are home right now. Folks are stuck to the tube. If they know at 12:15, the mayor is coming on every day for 5 minutes, giving an update. What's the incidence? What's the prevalence? How many people died? Here's the next steps. You don't need a physician script anymore to get a test, if that ever happens.
right.
That's the kind of information that should be conveyed on a daily basis. As you say, this is fluid. If there's a change, he can update people on the change the next day.
Yeah, but I think I think you are losing a whole segment. Social media is a powerful engine. A lot of people use that for all of their news, everything. You have to establish a footprint in social media
So you're
to
referring to
get
like
a message out.
I don't think any of this has to be exclusive. We can do them all. There's nothing to say that we can't use every means at our disposal. And I got a feeling that if it's going to be a combination of all these things that finally breaks through on some level. The point is, whatever it is we're doing is not working to the extent that we want it to. So we can't keep repeating the same thing.
Well, I just think you need a great communicator. You need an Andrew Cuomo of Trenton. Somebody's face that you can rely on every day, knowing that you're getting credible, fluid, reliable information.
That's true. I think
that could be Mr. Sawyer, that could be Mr. Paulson.
It doesn't matter
Dr. Evans, but somebody on a daily basis needs to be conveying credible information as it changes.
Yeah, that's absolutely right. Nobody, I don't think anyone disagrees with that. And you're right for offering those solutions. And there's more, because we also have to look at what venues the people are listening to. They may be listening to Power 99. They may be 105.3. It depends on understanding the demographic that you're trying to reach. And all of those avenues have to be in a basket of communication. I don't think there's any one or the other. I think they're all and more, because we want to see, when I walk outside and I look down the street, I want to see the brothers over there with masks on. Half of them got them on, half of them don't. And the younger ones think they're made of steel. So that tells me that they're not getting the message for whatever reason, and we have to figure out how to do that. I certainly can't do it one-on-one. I can do what I can, but we need mass communication skills. I just want to stick to the purpose of why we've gathered here tonight, and that's to talk about these topics and these issues. And I just hope that the deliverable that we're able to put together tonight is a cogent plan for all these resources that are available to move forward to get to that end goal, as to protect everyone in Trenton from this pandemic. And I hope that, well, I don't hope, I think I know that everyone here has that in common. That's our common goal. But how best to achieve it is another thing. So let us work with what we have, Mr. Sawyer, adapt it to the need that we're facing, and move forward from there, and then inform us what our role would be, or where you need us to step in. And we can then work with our organizations or individuals that we know to achieve that, so that we've done something that has provided a service to the people of Trenton at the end of the day.
Sounds good.
Well, another thing is that I'm going to keep harping on this because this is a major barrier. Somebody has to do something about getting rid of this physician script. That has to go. And I don't know who provided that direction. I understand the need for it, particularly if you don't have the capacity to test and you just have people lining up and not have the ability to test. But that's a major barrier, particularly in the Black community. Folks don't even have a doctor to see.
And I agree, and that's why Dr. Evans, as Dr. Evans said, we put other processes in place so that people that didn't have a doctor or couldn't get a prescription could do that. But I think we're violently agreeing personally, because everyone on this call has said we agree that that's a barrier. The question is, how do we get past that barrier? So,
but help me understand. I mean,
who put it there?
Yeah, who put that in place? That's what I'm trying to understand.
But that was before my time. So, and I think part of the process is this too. You got to understand that the city of Trenton doesn't even have really the capacity. So what we're doing, we're piggybacking off the county. So that mandate comes from the county down. Again, you got the federal government, you got the state, county, and then local. So unfortunately, your local government is at the bottom of the totem pole right now, right?
So it sounds like somebody needs to talk to Mr. Hughes and Kelly Gans.
Part of it is the test itself does require a physician to order it. So
I was about to say that.
As Dr. Evans mentioned. Yeah, go ahead.
Yes.
Which test are we talking about? Which specific test are we talking about?
So the RNA test that is, I believe, that the nasal swab test that's being done right now, right?
Okay, that's a PCR.
So in the places where, there's not a physician required a prescription required to go through the process, there is still a physician who's agreed to order all those tests. And in fact, the way it's happening right now in the county, the physician that orders the test is not actually the one that's signing the order to the lab. So,
right.
Correct.
So having to go through that whole process, I agree we need to get rid of that. Remember, this process has been running, it's like 6-7 weeks, I want to say. And when that process started, getting those 240 tests a day from BioReference was a miracle.
Right.
Now, it has not evolved since, and it needs to evolve because there is more testing capacity now, but nowhere near enough yet. So we're not yet, you're starting to see, there are, I think that we heard something from Essex County. There's a Rite Aid up in Essex County that was starting to do testing with, so they say you don't need a prescription. You walk up and then they have a nurse practitioner or another provider see you and write the order.
And then they in Robbinsville. They have a Rite Aid in Robbinsville doing it right now as we speak.
And and so that is run by an urgent care. And if you go there with an insurance card, they'll run the test for nothing. If you don't have an insurance, you'll pay $99. And so that's the barrier. Right now, the county is paying for the cost of all the tests. And Henry J. Austin is doing all of the visits for someone who calls and doesn't have a doctor and sorting out the billing later. But we've not seen that. Remember when there was briefly that In Focus urgent care at TCNJ, and there have been a couple sites that come up. Those are all, you got to have insurance or pay. So we made the decision at Trenton Health Team, and all the communications we push out we did not publicize the Robbinsville site because we didn't want people to get confused and end up going to Robbinsville and being hit with a $100 bill when they wouldn't necessarily expect that in advance. So we're all in agreement. We need to find a way to make it, if you need to get tested, go to this place and a test is going to happen. I don't know how that is. I don't know what the steps are to get from here to there yet. And I'm just being honest. You know.
Okay. Let me ask you the question. What is the status of the saliva test that they're working on in Rutgers? My understanding it was in the middle of FDA approval, but that was over a month ago.
So I can speak to that. It was just FDA approved just this past week. It's been undergoing. I know they've been using it in their correctional facilities, and we are definitely in line to figure out how we could make that available in the community. There's been a lot of conversation about sort of that balance between the saliva test, which can be done at home and done with less risk to the collector. So I don't want to lose sight of the fact that just for you to remember, every time someone does the nasal swab, it has to be someone in a full suit. And that's a big commitment and a big risk and big exposure. The idea of being able to do a saliva test at home, or even the Rite Aid test that they're doing is self-administered. People are administering it in their cars to themselves. Now you lose some of the accuracy, but there's less risk to the collector. So we've been talking about all of these solutions. The other thing I don't want to lose track of that Greg mentioned earlier is that right now Capital has what's called, it's a brand name Cepheid. It's a point of care nucleic acid amplification machine that runs that NAA right there, can get to the results in 45 minutes, but they're at maximum capacity. And so at Henry J. Austin, we have a little tiny machine. We're looking at what would it look like to try to expand that. So we're really investigating all these different solutions because we feel so strongly that we need to expand that testing. The main barriers, as you said, are actual resources, actual people, actual equipment, and actual money. And trying to leverage all of that is what we're working on. I think up until now, compared to some other communities, as Greg says, we've actually been fortunate in our relationship with the county that we've been able to offer that testing without a cost to the person, but there's still all those barriers we discussed. So I think I can certainly give our commitment that we know this needs to evolve and we want to make that access available to everybody who needs a test. We just can't tell you what exactly that will look like because things are changing so quickly at this point.
Is it possible? Are there more Cepheid testers available? Is this one of those ventilator things, or is it a matter of money?
It's a matter of money, and I can't really speak for Capital, but I know from Henry J. Austin, we have the unit that we lease, and the leasing is the real cost. It only has so many tests it can run at a time, only so many bays. And then the test kits themselves, we've actually reached out to Cepheid to price what that looks like and then think about the cost of staffing because currently all of our nursing staff is engaged in doing the remote work that we do to provide that access to the community. So we'd be looking at new staff, new PPE, and test kits. So that's just an expense and a logistical situation. Capital has I'm sure, larger machine, but there's only so many tests it can run. And even with that, what they've been running into is a limitation of the number of test kits available. So they order the test kits from the company themselves, and that has been limiting their rate as well.
And there was a reagent issue too, I think. So the chemicals needed to process the test kit and the supply chains for these are pretty narrow. So there's a backlog on buying new machines. There's a backlog on the test kits and the supplies needed to process them. So it's multi-pieces that are preventing those machines from running more tests.
Well, what about the rapid antibody test?
So we've seen a lot of our laboratories, Quest, LabCorp, BioReference, aggressively marketing serum antibody tests, which get sent off to the lab. I think the challenge there when we talk about a community solution is that we know what to do with the, as you say, the PCR, the ones that diagnose that you have COVID right now. The antibody tests, there are so many on the market, so many of them have not been FDA approved. And in terms of their sensitivity and specificity, what exactly do they tell us about if I've truly been exposed or was it a different coronavirus? Can I say that I'm now protected? what is that utility in terms of going back to work or going back to school? So many questions there that I would say, and I can only speak for Henry J. Austin, I'm clearly not speaking for the city or anybody else, we're still just in the information gathering phase, and we haven't gotten enough information that convinces us that any specific antibody test is going to provide that benefit for the community that we want to start offering it. Now, if someone comes up to us and does a telemedicine visit and says, I hear LabCorp has an antibody test, I want to get that test done, we have them have a visit, they have that conversation, we explain the risks and benefits, we discuss the utility. We always try to ask the question of, well, what are you going to do with that? Because we don't want a family to decide they need that test and then use the results to go back to work when they shouldn't, or stop distancing when they shouldn't.
Yeah, that points at the reason why I was talking about a plan in the first instance. What is it the plan is trying to accomplish?
Exactly.
You have to have a goal in mind, an end goal in mind. And that's just walking up and getting a test doesn't necessarily do that. And I understand that. What I'm thinking about is the logistic challenge. I'm thinking about his finger stick on in a blood spot and a rapid change of color, which gives you the result 15, 20 minutes that tells you either positive or negative for COVID-19. And maybe it could be IgM or IgG and antibody testing that tells you if you had it or not. And I don't know if there is well, you're using the nasal swabs for the symptomatic people or the saliva test. So I'm thinking it's a combination of all of them to get there. But of course, if you have to know what the end goal is in order to apply these things. So, well, I'm just asking, let's identify what the end goal is and what steps we're headed to get there.
One of the other issues that I'm seeing is with regard to employment. What's happening on the employment scene is that an individual goes to work, gets notified by their employer that you were working with Joe yesterday, and Joe just called us and says he's positive for COVID-19. So now they send this individual home. If this individual lives in the city of Trenton or Mercer County, what employers are saying right now is you cannot come back to work until you prove to us that you're not positive. So again, how do they get the test if they don't have a script? And if they can't get the test, they can't go back to work, which means they can't pay rent, they can't buy food, and it creates a whole cascading series of events. So, Mr. Sawyer, if there's another thing that you could share with the mayor, we need to address that concern as well. And that's not specific to Trenton, that's specific to the entire nation.
But I think the FMLA has specific rules regarding that. So if a person needs to get tested, again, they would have to get a prescription, but an employer cannot fire someone for being COVID positive or for being self-quarantined because they've been exposed to COVID. So there's been some specific FMLA changes to address the COVID pandemic.
But I guess what I'm trying to share is that what the trend now is that employers are placing the burden on the employee to show that he is not positive before he can return to work. They're not firing him. What they're simply saying is you can't work until...
You can't work. You don't want to affect the rest of my employees. Yeah, it's completely understandable.
So I don't think that's across the board, though. I don't think everybody's following that process because I know for city workers, after their 14 days, they're letting them come back to work. So I'm not sure that, I don't know what's happening in the private industry and things of that nature.
Yeah, but that's why I'm bringing it to the attention of everybody, because you're going to hear more and more of this, because unfortunately these employers are placing this burden on employees, and folks are going to lose everything because they're not working.
And if you work in a job that doesn't have paid sick leave, you're in a world of hurt.
Well, the CDC says you can come back to work if you don't have symptoms. Just because you've been exposed, you don't have to self-quarantine. You can come back to work as long as you wear masks and gloves. So the CDCs have adjusted that to help employers deal with, especially those employers that have what you call the workers that are essential employees, right? So the CDCs has tried to adjust to help with that situation, but I agree with you, it's still a concern, but there are some processes in place so that these people can still come back to work if they don't have any symptoms. Just because they've been exposed, they don't have to be self-quarantined.
Can I speak to something about that? And I apologize, I'm going to have to sign off shortly because it's my kid's bedtime. I wanted to mention, as you speak about FMLA, I think it's so important to remember the significant percentage of our city residents who may not be employed in a situation where they have legal benefits. So our undocumented community members often can't count on any of that legal support. And we have those conversations with our patients every day at Henry J. Austin. The other piece that I always keep in mind when we talk about a plan for our city and what would it mean to relax some of our restrictions is just the really important concept that when we talk about doing essential work, if you look at the data, the vast majority of what has been deemed essential is actually done by women and often women of color. And they're often in positions that pay so little per hour that they're in this terrible bind where if they were unemployed, they'd be making more right now. So they're doing hazardous work. They don't have access to the testing they need. They don't always have access to the protective equipment that they need. And they're not getting paid anything in additional. In fact, their family members who've been lucky enough to be laid off are making more per hour than they are. And so I think the most important thing to remember about that is we are all committed to trying to find a path forward to better testing, as I said, but I think all those other pieces need to happen as well. Because even when the testing is in place, we don't have a great plan for our most exposed, most vulnerable workers. We don't have a plan for our most vulnerable families. And when I say we, I don't mean we in Trenton, I mean we in this nation. Right. And then of course it sort of trickles down. And the last thing that I want to say just on behalf of the resources we do have is please help us spread the word to access the testing we do have, that we continue to work on making that testing more available. And when somebody is in one of those situations where they're negatively impacted by COVID, they should reach out. They should look at the Trenton Health Team website. They should give them a call. They should call Henry J. Austin if they need an appointment. They need to talk to a social worker. We can help make those resources more available. There aren't perfect solutions, but there are often better answers than what people are living with.
All right. Thank you, Doctor, for attending this evening. We appreciate your input. It's vital for us to understand exactly the state of affairs here in the city. I just asked if you would you be interested in doing these more as I gather more people around this issue? Would you be interested in joining us on a future Zoom call?
Would love to. And thank you so much for the opportunity to participate. I really appreciate all of your engagement and advocacy. It's been great, and I would love to participate going forward.
All right. Thank you, Doctor.
Thank you so much. Good night, everybody.
Good night.
Thanks for your time.
Algernon, this is Monica.
Hi, Monica.
Have a comment and a question. I did hear something. I think Mr. Polson made a comment about identifying areas by zip code with high infection rates.
You go ahead and speak to Mr. Polson about it.
Yeah, sure. So the data that we have now this is from the county testing site. So this is not people that would have had results from going to other doctors or something else. But we, as I mentioned, our contribution to this countywide testing process is we provided the data system in our health information exchange. So yes, I see data broken down by zip code, and we can see the zip codes where the number of people who've been tested positive out of the total number tested from that zip code is higher. Now, that is a very imperfect measure. It's not a representative sample of the population, but it does suggest areas where more testing is needed, perhaps more urgently than others.
Right, and it's a starting point. I was thinking something that we did in HIV called targeting testing.
Yep.
By zip codes.
Yep.
Is there those zip codes that were identified? is there a central location where the testing site is?
The testing sites in each ward are at churches that we picked because they're as close to the areas where, there's the most residential density as we could get. But that same thought process, frankly, goes for all of Trenton. The testing rates in Trenton are 8 percentage points higher than the rest of the county. It's actually more than that because the county's numbers include those numbers from Trenton. So if you pull Trenton's numbers out, there'd be more of a difference.
All right. I guess what I'm asking is, those testing sites at churches, are they in that same zip code?
Let me just look at an example. So our site in the South Ward has the highest positivity rate, but so there have been 40 tests performed at the South Ward testing site. Those results came from 1, 2, 3, 4, 5, 6, 7, 8, from 9 different zip codes. Most of them are 08611, which is not surprising, but there are other zip codes as well. So the data tend to be a little messy, particularly at these smaller numbers.
Okay. I guess what I'm getting at is the barrier. Sometimes, all right. We know that there are barriers.
Yeah.
Some barriers we're not going to eliminate. Some we can kind of get around them.
Yep.
I did hear someone saying that using some of the hospital mobile units, I'm just trying to look at non-conventional or non-traditional. You got to meet people where they are.
Amen.
Yep, I agree with you.
That's something that we did with HIV. And you have to understand, people are looking at the 5 necessities, and health is not one of the 5.
Yep.
They're looking at shelter, food, making sure the children are okay, making sure that the roof over their head is satisfactory, and their health is further down the list.
Yep.
So we have to be able to meet the person where they are. That's something that we used with HIV, and it worked. So that's maybe that model we need to look at it and kind of tweak it for what we need with COVID-19.
I agree. The statistic I can give you from the walk-up sites, and I think it was like Director Sawyer shared this with me, in healthcare in general, there's a fairly high no-show rate, right? People schedule an appointment, don't come. No-shows have been almost unheard of. Maybe there's one person a day who doesn't show up. So that does say when people are in this process, they follow through with it. They get the test. So clearly people are motivated to get tested. I think there's a big barrier to entry that, the call Henry J. Austin, just give him a try. Some people love Henry J. Austin. Some people don't love Henry J. Austin. Some people have all these different experiences. I can tell you, I have a lot of conversation with Dr. Evans, and I would have said this if she was still on the phone. She is very clear-eyed about some stuff's working, some stuff's not working. They're doing the best they can in really challenging times, and they have a really strong commitment. So the biggest suggestion I give to people, just give it a try. Give them a try, see if they can help you, because I agree with you, Ms. Talbot. We need to do more of this. We need to get closer into where people are. The reason we started the sites 1 per ward was along that same mindset. But it's not enough yet. But it's something, and there are 12 people scheduled for tomorrow. There could be 30. So there's more testing that could be happening that we're not yet taking advantage of. So I don't want to at all say, we don't need it because we're not using what we have. That's not what I'm saying. We absolutely need a lot more. But while we're fighting for that, let's make use of every single test we possibly can.
Okay. I think another barrier is fear.
Absolutely.
I hear it every day. Yeah. It is fear. People are in such fear of this disease, thinking that if they got it, it's a death sentence. And we have to overcome that fear. The other thing, and unfortunately, I think in systems and processes. Dr. Evans made a comment about after you get that positive test result, they have a team of social workers that go out. This could be an opportunity for some sort of contact tracing right there. When we go or do a phone contact with the family or the person who tested positive, maybe there is a point where we can ask the question just to get the person thinking, where have I been in the last couple of days?
Yep.
Who was I with? And those are the people that we probably need to look at in getting tested.
Yep. So I think let's put the social workers at Henry J. Austin don't go out. They're available. They're doing all their visits by telehealth. But what I think you're describing is that contact tracing function that falls to the local health departments. And that's where the governor just made the announcement they're hiring 5,000, contact tracers. That's where we're saying, okay, well, how's this going to happen? Because the city health department does not have anywhere near enough people to do that contact tracing, but that's exactly what has to happen. We're going to really get this under control.
I'm just thinking that we can at least ask the question.
We have to. And that's what the city's health department staff are doing, but they're not going to be able to keep up with what they need to do to reopen everything we need to reopen. Our other concern, frankly, is that as the state is looking to hire people to do contact tracing in communities like Trenton, we don't want them to go to some staffing agency and just start hiring, a college grad out of somewhere who doesn't know the community and start having them try to call people, say, hey, did you run into so-and-so because you might be, they're not going to be able to talk to anybody, So people need to be hired from our community who know how to talk to people, who know who to talk to, who can make this stuff work. Because if we can't follow up on contact tracing and do it well, we're going to be stuck with this for a heck of a lot longer.
You think maybe a research scientist who's a Trenton native who recently retired might qualify for doing contract tracing in Trenton?
But it's, we talked earlier about, just people hanging on the corner. That's the stuff that's breaking my heart right now. Because yes, we need to get tested, we need to do all this stuff, but a lot of that is out of fear, right? Younger person, the way you deal with fear is denial. I'm invincible. I'm not afraid of it. And this is how I'm going to show I'm strong. I'm going to show I'm strong by not showing my vulnerability, right? And that's,
suicide.
Well, I've gotten, oh, this is a hoax.
Yep.
It doesn't affect Black people.
Yep.
Well, it's a Democratic hoax because the president said so.
But I'm just saying, this is what a lot of young Black people are saying.
Well, they don't know the answer. And it takes someone to say, what's wrong with you, fool? You can't beat no virus. What's wrong with you? Look, here's this. Look at the information. And by the way, you get their attention. But it does take sometimes that kind of interaction with someone who they trust. And that's why it's so important to build your credibility up with the people in Trenton and provide them with continuous factual information, and you become someone they can trust your word with. And Keith was right on point when he said that we need a Andrew Cuomo. And because the man is totally credible. And the president is not. And that shows you it's not just getting on television, it's coming prepared and being honest and providing useful information. So yeah, we need somebody like that. And we also need somebody who can stroll down the block and Pookie's cousin. So, that all of this fits into an overall scheme. And I guess we're at our
we should probably wrap
it up. But and so we can end where we began. Is it possible that we can get together again for calls that are similar like this? I don't think we need to do this every day or every week. perhaps another week from now or a week, 2 weeks from now, I'm going to try to come together again to see where we are. And in the interim, is it possible that the healthcare professionals can begin to collate some information that they would want to see passed on to the public? And then we can start thinking about ways to make sure that word gets out in as effective means as possible with the churches. There's plenty of pastors on the line and other community-based organizations that be willing to do it. And then we can talk about what format it needs to be in order to be as effective as it can. Is that something that we can agree on? That we can begin to formulate something that we can present to the people, the affected people? Any
That
objections?
sounds good.
Sounds
Mr.
good?
Paulson, this is Monica again.
Yes,
I'm a data person. So if there's a way to clean up that data, maybe we can really get a true picture of what's going on in the city of Trenton. And by the way, I do a lot of data for Clara Gregory. So I kind of, that's like my wheelhouse.
That would be great. So I'm putting my email address and my phone number in the chat. Feel free to reach out to me. We actually, as of 3 weeks ago, have finally hired our own data scientist at Trenton Health Team. We actually hired him away from Bank of America. So he doesn't know healthcare, but he knows data. And we're doing the best. We sit on a ton of data. The challenge with it is, as you know, is putting it in a format where it can go out in the public and give the right message. And what's going to happen right now, if you compare our dashboard to the one the city puts out, to the one the state puts out, to the one the numbers aren't going to match.
Correct.
Because they're coming from different places and different sources. So what we're going to start fighting about is these numbers are all lies. They're wrong. They're false. And that's not true. They're just right in different definitions. So
Correct.
we're really struggling with what are the right sets of numbers? I know the city's got the dashboard up that you guys just announced this morning. I haven't had a chance to talk to you about it yet because we got a bunch of questions about what's this mean? What's this? So there's and that's data people coming to it. The message we need to get out needs to be a lot simpler. Michelle is our communications person who's on the line. This is still with us on the call. We had to get it down to 3 things. Stay home. You got to go out, wear a mask, stay apart. And because simple messages, we work with a bunch of different social media influencers that we started working with on our Tobacco 21 campaign, and they've been sharing out messages for us. With Sino Lowry and Leon Rainbow, Lakeisha, just different lots of different formats from lots of different people given the same themes. This is real. Take it serious. It's not just about you. It's about your family. It's about your mom. It's about your grandmom. It's about your aunt. You don't take this serious. You go home. You feel fine. You bring it home with you. That kind of stuff. Just trying to make it real because we don't know who's positive. We don't know who's got it, and we're not going to know for a long time.
Right. I mean, what I'm thinking of is if we have the data, we develop programs, testing programs to represent what the data is telling us. We also need to build an education module to educate people on why you need to get tested, why you need to know, so then you can better manage your health. Because, truth be told, a lot of us have, other illnesses that are precursors to other things. And with this particular disease, it accelerates those particular illnesses.
Yep.
So we need to know our statuses.
Well, you said it exactly right, Monica. We need to know this information in order to protect ourselves. And I think that's where we started this conversation. And I won't drag the call any longer than it needs to go. I thank you all for attending. Is anyone got any final questions before we give people their lives back? Okay.
Well, thanks, everybody.
Yeah, just say thank you to everybody who's taking the time. I'm going to look for maybe next week. Is that okay? We look at next Wednesday to maybe have a follow-up call and see where we are with trying to formulate something, some kind of a marching orders. Let the data inform us what we need to do, as Monica just eloquently pointed out, to drive us forward. Follow the data, as Fauci says. So let's update next week. If the same time works for everybody, would you mind doing that? No objections. So I'm going to wish you all a good evening. Thanks for sticking your head in there, Keith. I appreciate it, brother. And I'm going to make some notes up from what the salient points are tonight and try to get it to you all. So I just thank you all very much and for your time.
Good night, everybody.
And may God bless you.
Good night, everybody. Stay safe.
Good
Bye-bye.
night.
Good night.